everyone, I'm Becky, the nurse practitioner at Garcia Facial Plastic Surgery, and I'm here today with Dr. Garcia and Lori, our esthetician, and we wanted to tell you about some lunchtime treatments. Some of the things that we do here take a little longer and require some downtime, but there are a lot of treatments that you can come in and have some significant improvement that can be done very quickly, and you're back to work right after them. So, Lori, do you want to tell us about some of your favorite lunchtime treatments?
So I can do chemical peels. That's on average it takes 20 to 30 minutes to do that. That's just really cleansing and doing a manual exfoliation. Then I do a chemical exfoliation of the skin, put some sunblock on you, and send you on your way. So you can be back to work within a 30-minute time frame there. Also, one of the things I do is dermaplaning. So dermaplaning is one of those really neat procedures where I get to use a scalpel, and we actually shave, for all intents and purposes, the skin. So that's an exfoliation of the skin, but one of the side effects is you get rid of that vellus hair too, which a lot of women love. So that takes on average, anywhere from 20 to 30 minutes as well. If you have a little bit of extra time, I could actually throw on a mask that's customizable for you as well, whether that be to hydrate or help take care of maybe some active acne spots that you have on the skin too. Hydrofacial and express hydrofacial is something that takes about 30 minutes too, so that's great because again we're working with the dermal level, and those super serums go straight down to the dermis and help to hydrate the skin too. So that's one of your red carpet ready, just come in for your small lunch break and go back out looking amazing.
And what kind of changes do people see in their skin after one of your peels?
I'm always amazed at how good, because we use the self-neutralizing peels. So the nice thing about those is we don't have to take them off or time them or anything. So you actually walk out looking better than whenever you walked in, because the skin just looks really radiant whenever you're leaving. We are able to put sunblock over top of that as well, so you're protected, too. It's got about a 4-hour window where it takes, time to self-neutralize, and then you can wash your face that night before you go to bed, and you're all good.
So that sounds great, and I can tell you from experience, any treatment you have in Lori's room is going to be very relaxing and spa-like and makes you feel really good. And then the treatments that I do, of course, are not quite as spa-like and relaxing, but we can get you some great results. Botox treatment only takes about 15-20 minutes or so, and most of that is just talking and figuring out, exactly what it is that you're looking for. And then the actual injections move pretty quickly. And then you're right back out the door. We could put makeup on over top of where we were injecting. Another pretty quick and easy treatment would be facial fillers. And that's just adding back volume basically wherever you want it. As we age and our facial volume descends, just adding back a little bit of volume in just the right places can make a huge difference. And you see those results right away. And sometimes there's some swelling, but it's usually pretty minimal, and people can go right back out the door, back to work, feeling good. And I'll always ask people when they come back at their follow-up visit, did people notice that you had something done? And the answer is usually people just said that I looked great or I looked refreshed, but they didn't really know what it was that I had done. And I think that's the best compliment for people to get with these kinds of treatments.
I think there's two important points that you made there. The first one is not with the neurotoxins. The neurotoxins take about 3 or 4 days to work, the Botoxes, but the facial fillers, a lot of people think that the results are going to develop over time, and the case is the opposite of that. With facial fillers, you see the results immediately. We have patients, in fact, look in the mirror to confirm their results immediately after doing it. Now, like you said, there's always a little bit of swelling after a facial filler or any injection for that matter, but that swelling is short-lived and it's usually gone by the next day. But people can certainly go back to work the same day. With facial fillers, it's also important to note that they're not particularly painful anymore. A lot of these facial fillers have lidocaine mixed into them nowadays, and so the process is fairly pain-free. We don't typically have to numb patients like we did in the days of old when I started my practice, and so nowadays the injections are pretty smooth. and patients rarely have any serious discomfort when they're having these procedures.
Right, that's a great point.
Yeah.
People normally get nervous before the injections, and then after they say, it's not nearly what I thought it was going to be.
I hear that all the
Yeah.
time. They say that all the time. This wasn't anywhere near as bad as what I thought it was going to be.
That was my personal experience too. Becky's done my tear troughs and my cheeks, and neither one of them hurt at all. And I get the PRF injections regularly too.
Right.
And it just doesn't, it's not bad at all.
Definitely like to keep people as comfortable as possible.
Right.
Yeah.
And yeah, the fillers are fun because you see your results right away. It's the best part of my job is handing someone a mirror after their treatment and seeing their reaction and how pleased they are. So if you've been thinking about trying any of these things, you know, you can come on in and do it on your lunch break.